Hi, everyone. We're going to give everybody a little bit of time to get on. We had 750 people sign up, so we're just going to give everyone a second to log in. While we're ready, you can see on the agenda what we'll be talking about today. Again, just for anyone just now joining, we're giving everyone just a few minutes to join. We had 750 people register, so just want to make sure that they all get a chance to see the entire presentation. Okay. Well, about usual, it's about half that end up actually attending. So out of the 750, we've got about half of those, and we'll go ahead and get started. Jason is joining us here from Florida. He's with Member Benefits Inc., who administers our private health insurance exchange. We had 50% of our attendees today joining us from the four largest Texas counties, and about 50% of them are solo practitioners. We are going to have information about individual products and group products. So we'll have something for everyone. So make sure to stick through the entire thing with us. So I've been with the bar for 16 years now. And Jason, who's with Member Benefits Inc., has been with them for, I think it's been 9 years. And
Yep.
he's got 20 years of experience in the insurance market. And just before we get started as well, I want to mention that we will do the Amazon gift card. We'll do it following the webinar. So we'll do a random list of folks that attended the presentation today and then send out an email right afterwards. And just before we dive in as well, I want to talk a little bit about the history of the program. So the bar's been offering health insurance for about 76 years to Texas members. My task with the bar is to constantly monitor this program through presentations like these, traveling the state, visiting with law firms. We also do customer satisfaction surveys of everyone that enrolls in the program. So a little more advocacy coming from the bar's side of it versus what you're going to get through going through any other marketplace on the market. Following the Affordable Care Act in 2013, we created this current exchange platform in order to benefit all members across the state. A lot of the options out there, you can form a group, which usually just helps those that are already in firms and leaves out those that are solos. But solos are the ones that need the most help from us. So we definitely wanted to make sure that we had something that expands the entire breadth of the marketplace in Texas. So we did an in-depth research across the nation, and Member Benefits by far was the best option for members. Due to their great programs, their service, and their continued innovation, I'm happy to report that they are now working with 900 law firms, and that's just in Texas. They work with several other state bar associations across the country, so an extensive amount of experience with the legal marketplace specifically. Jason, do you want to go ahead and kick it off?
Yeah. Corey, did you want to pull up that agenda?
Yeah, we'll show that again.
Yeah. Cool. Yeah. So we're going to do, and Corey did a little overview of the history of the private health insurance exchange. We're going to have a little something for individuals, families, and solo practitioners at the beginning. We will stop at that point and answer any questions. Tom is with our team. He's fielding some questions, and he'll be collecting those. And right after that section, we'll answer those questions, and then we'll get into options for groups. And then we'll have some times for questions specifically about the group products. And then after that, we'll just have open Q&A. So feel free to type your questions in the chat box as you think about them, and we'll have 2 or 3 times that we stop throughout this presentation to answer them. So go through a little bit about what I'm going to cover. There's 4 main topics that I'm going to get through. Mainly, the value of a licensed benefits counselor, what is unique about the private health insurance exchange. We'll get into specific options for the solo practitioners, individuals, and families, and then work with small, medium, and large size firms towards the end on group options. So there's a few ways people shop for health insurance. The first instinctive way is to go to Google. Some people might go to healthcare.gov, other people might work with an insurance broker. If you go to Google, you're going to receive multiple unsolicited phone calls. You've probably had this experience before if you've done this, and probably hours sifting through data trying to find out which site is credible. Healthcare.gov is a little better than a Google search, but you're still shifting through a lot of data and you're getting information from navigators, not licensed benefits counselors or licensed insurance agents. The third one is probably the best, is to work with a licensed insurance agent who will help you provide guidance, through the process, and somebody who can actually recommend solutions for you because we are licensed.
Jason, maybe you can walk them through how to choose a good insurance broker.
Well, that's kind of the value of going through the private insurance exchange. We have a lot of seasoned benefits counselors. We're all licensed insurance agents. Many of us have 15, 20 plus years of experience in the industry, and specifically most of that time too dealing with law firms. But it's not only that, we also have a really neat way that you engage with us. Instead of calling a 1-800 number and sitting on hold, we have a very unique calendaring system. So you can just go in, schedule an appointment with us at a time that works for you. Our benefits counselors are busy throughout all open enrollment. And we find this has been, very successful for attorneys, all throughout the country. And I think we're going to put the link in the actual chat box for that.
Yeah, Tom, if you could just share that, how they sign up to schedule an appointment with the counselors, that'd be helpful, I think, for everybody.
And then, when you do come to us through the calendaring appointment, it's going to be a much different experience. It's not a high pressure sale. We're here as a resource for the bar. So you're going to get really 3 things when you come to us. You're going to get a consultative approach. So it's all about giving you multiple options and talking through your health scenario instead of just trying to pressure you into a product. So you're going to come away feeling like it's consultative and very collaboratory. The other thing that people tell us a lot is they come away with more knowledge. So most of the clients experience creative solutions or information that they've never heard of before. And then the last one, which is very important because this is a once a year decision. Most of the time you can't change it. So a lot of people come away with confidence that they've seen all their options and they are making a really solid choice for their health insurance. Also, a big difference between private health insurance exchange, Google, healthcare.gov, is that we give you the ability to engage with the benefits counselor throughout the year. So you would work with them on the initial process to get set up with the product, but then any service concerns throughout the year, you can go to our service team directly or directly back to that licensed benefits counselor.
The benefits counselors end up being the most powerful part of the exchange, particularly for the solos. If you're a large firm, you're probably getting really good service. If you're not, I also recommend you going through the exchange. But as a solo, it's much more harder to get the guidance and get somebody on the phone to help you. So I would definitely check out the exchange. That's not the only way that they're unique. And I think Jason's going to walk through some of the
Yeah.
other ways.
And definitely, to your point, Corey, as a group, you definitely have to have that because there's a lot of service in group, as a lot of people know. So we'll get into, what's kind of unique. Well, again, we're talking about individual stuff here. We're going to get to the group stuff at the end. Just remember, keep putting in your questions. We'll get to them after the individual section. But we have private individual plans that are not available on healthcare.gov. A lot of people ask us if we can help out with Medicare, a lot of over 65. So we have Medicare specialists on staff that can help you with non-traditional options and get you set up for the right Medicare supplement, run all your prescriptions, and make sure you're set up properly. We have a lot of discounted ancillary products like the dental, the vision, life, disability. It's all done through an easy to use exchange platform. And for firms with 10 or more employees, we have a complimentary electronic enrollment system that's typically only available for firms of 50 or more. And then lastly, and we'll get into this when we get to the group stuff, we have an exclusive association health plan called Members Health Plan that's been around for over 7 years and is a great solution for law firms.
Just to add a little bit more about that association health plan, I'm hoping a lot of you have already heard that in the last legislative session, they passed a ruling that solos would be able to join association health plans. The rulings from the Department of Insurance just came out, which is a great sign for us, and they're kind of working through all those rules. The hope is that in January 2025, that'll open up that market to all the other solos in the state, which is going to be the only association health plan that I'm aware of in the nation that's going to be ready to go that quickly. Keep your eye out for that because it's going to open you up to a lot more options, and you're also going to you won't have to follow that enroll once a year. You can enroll throughout the year for the group plan. So if you do enroll in something now as an individual and that plan comes available, you could switch to that later in the year. So just keep your eyes out for that. And I know, Jason, we're going to talk about those solo and firms now.
Yeah, so if you want to pull up, we wanted to give you an idea of what's happening in the market. I've seen, I've been in the industry since 2001. I would say in the past 10 years, in the past, there's more options available now than in the past 10 years. So you're going to see in your county, there's a lot more individual plan options available than there has been in several years. So here's we just did a graphic here for Austin and the different counties. You can see many counties have several new options. Dallas, what do we have? Houston has a ton of options. San Antonio. Yeah, so there's going to be a lot of unique things, a lot of unique carriers. So that's why it's important to schedule that appointment with the benefits counselor so that you can learn about each of the carriers. So a couple considerations when you actually schedule your appointment. The first is to consider your income. And I don't know if you want to throw that graphic up there on the screen. A lot of people don't realize that there is actually quite a bit of subsidies available even for higher income earners. So this is an example of family of five, 200,000 a year, and they're still going to qualify for over $12,000 in subsidies.
And
So
Jason, I just want to add too that we'll share these. We're going to post this video, recording on the video online at texasbar.com/benefits. And we'll add these slides in there. So if you've missed anything about what carriers are available, we'll have it there as well.
yeah. So, I mean, this is going to be the first question you're going to want to work through because if you can get a subsidy, that's great. And you can still apply this towards private insurance. So that'll be the first question the benefits counselor will work with you through. The second is to work through your personal health scenario. Do you use health insurance frequently, or are you looking for something just catastrophic? You might want to consider an HSA, a high deductible health plan, if you're looking to tax shelter some money. So they can go over all that. Maybe you have an upcoming planned procedure. You want to tell your benefits counselor about that because that can make a difference in the plan that they recommend. The third would be some other personal preferences like hospitals and doctors that you want to be in the network. Do you have any dependents out of state that we need to account for? Make sure there's a network in that state. And maybe you want a Cadillac type of a plan versus a HDHP high deductible plan. You want something that's just no matter what, it's very predictable. So all those things you can just let us know and we can customize a plan for you. The other one that you might want to consider is if you are healthy and you're willing to go through a medical underwriting process, there are a few options that we can work with you that they're not ACA compliant. They're pre 2014 plans, but they still have good networks. Some of them even have PPO networks, and you might want to look at that for an option as well. So all these are, I guess, the main considerations if you're a solo. And I guess if we want to, Corey, we can jump to questions unless you have anything else you want to jump in
I would
on.
add too that one of the things that we end up seeing confusion with is that a lot of folks that see themselves as solos can actually qualify as groups.
Right.
I think it could be helpful for everyone to just define what that means to be in a group.
Yeah, and that's a good question because uh, if you're an individual, you have just options to the individual market, but the group has a lot more PPO options. So a lot of people want to qualify because of that. So if you have at least one W-2 employee that's even your spouse or a child, then you are able to qualify for a group plan.
Which is new. That used to not be the case. People used to comment that they had a spouse or a child working for them and they couldn't qualify, but now that has changed, which is great news. I think it's a good time now to kind of go through some of the questions just for the
Jump in
solos
on
before
questions.
we
Yeah, that's
jump
a good
into the
idea.
group. Tom, were you collecting any? Do you have any that you want to ask?
Yeah, we've got a lot of really good ones. There's one that keeps popping up though, which is, are benefits available to members living outside of the state of Texas? And I know that some of the benefits, Jason, on the exchange do have certain state limitations like life insurance and disability, but I think most of these questions are specific to health insurance. So do you want to address the both health and group side?
Yeah, so yeah, we do have products available to people living outside of Texas. Um, so if that's kind of the question, we have definite options that we can work with you on. And even if you're in Texas, but maybe one of your dependents, like your child, is outside of the state, we can still get a plan that's right for both of you.
And what about for people who have employee group plans, for people who have employees outside of the state?
Yeah, so we're licensed in all 50 states, so we can work with anybody. Um, so yeah, and a lot of the groups, they're domiciled in Texas, but they have employees in multiple states. And we just make sure that the plan is set up with the proper network that covers your employees in those states, and we can actually do network comparisons.
Okay. Uh, One person or a couple of people asked, what is the fee, the consulting fee to talk to a benefits counselor?
Yeah, so I mean that's the great thing is it's built into your membership. This is a benefit because you are with the State Bar of Texas, and we're a resource for them. We are compensated through the sales that we make, through the group products or the individual sales that we make, but we don't charge any additional fees for the consultations. The consultations are completely free, even if you don't purchase any insurance from us.
Okay, and then a couple questions regarding specifically individual and what open enrollment is. You had mentioned at some point you said enrollment is once a year. What does that mean? And can you only enroll during that time?
Yeah, so it's a great question. If you're an individual, you can only enroll during November 1st and December 15th for a January 1st effective date. And then they extend it up until I think it's January 15th for a February 1st effective date. Outside of that time, the only way you can enroll is if you have a qualifying life event. You get married, divorced, you lose coverage elsewhere, you relocate. But this was all put in place in 2014 with the Affordable Care Act. So on the individual side, if you don't have that second employee and you're not a group, this is the time of year to go ahead with your enrollment. and that's the only time that you can enroll in an individual product.
And then someone asked if they do they have to make an appointment to enroll, or is that something they can do on their own?
Yeah, you can make an appointment, but you can also go directly to our site and you can enroll directly in products through the site without talking to a benefits counselor.
And the difference there too for the individuals is two groups. Groups can enroll throughout the year.
You had said that some of the other plans are not ADA compliant. I think they might have meant ACA compliant.
ACA compliant. Yeah, there's a few plans out there because there used to be an individual mandate in place that required you to have individual health insurance that was ACA approved. And when the individual mandate was removed, then carriers are able to offer plans that they were offering pre-2014. They're not ACA compliant, but they still are good major medical plans, and they do require medical underwriting.
Okay. Here's a good one. If I've already been working in previous years with a healthcare consultant, what's the benefit of changing to a consultant at the State Bar Texas Private Insurance Exchange?
Sure. Well, that's a great question. If your consultant is doing a great job for you and you're seeing a lot of options, coming to us would really just be sort of a second opinion analysis. And if you walk away from the appointment with us and you feel that your current consultant has walked through all of the options with you, then you certainly feel free to stay with your same consultant. We want to make sure that we're providing value. So, but I'll get into this on the group side. There are a lot of reasons why people switch to us from other consultants. So I don't know if they're speaking on the individual or group side, but I will get into a couple examples of that on the group side.
And
Is
Jay,
there
I would also add too, in terms of there was questions in there about will this be less expensive? Same question about is it the same stuff you'll see on the federal exchange? And I think the answer is that while you can't discount major medical, you're going to have probably more options and options they can't find elsewhere, and some maybe ancillary products that are discounted due to the group rates. Is that correct?
Yeah, that's right. That's right.
Yep, you just answered the next question. One person asked if there was a difference in cost, or are there any other benefits to enrolling early versus, say, in December?
Well, there's no cost benefit, but we highly encourage it because if you wait until the last minute, we have some people trying to come to us on December 14th, December 15th. Everything gets really overloaded at that time, so we always recommend people to enroll early. But no, there's no price difference. But that would be great if the carrier started to offer that. We would definitely promote that.
Okay, here's one. Someone has an S corp, so all the income flows through one person. Is that what an individual plan would be on, or and could their wife also be covered?
Well, so if you hire your wife as an employee of your S corp, then you can get a group plan. And one thing we're talking about, individual plans, you have that window of time. Group plans, we can get you effective dates all throughout the year. So you're a lot more flexible. So if you're willing to hire your wife through the S corp, then you could qualify for a group. But if you don't have any other employees but yourself, then you do need to enroll in one of these individual plans.
And Jason, we showed a few slides about plan options in some of the larger metropolitan areas. What about the rural areas? Will there be changes there as well?
There's a lot of new plans all throughout Texas. We just, for the purpose of brevity and a few slides, we couldn't do all of the areas, but that's, you schedule the appointment with the benefits counselor, they're going to quickly be able to pull up all the plans in your area.
I also want to reiterate, in case anybody missed it, is that we have the association health plan that the legislature has now approved that solos can join those, and the Department of Insurance released those rules. So the idea is that we have to review the rules and hopefully make that available to individuals in January 2025. So just keep that in mind, like some of these group rules could go away for plans like that. But I think it is an underwritten plan. Is that correct, Jason?
Yes, it is. That's right.
And I know we haven't got to group yet, but there are quite a few questions coming in about the difference in enrollment times between individual and group. Or
Yeah.
groups, do they have to enroll by this open enrollment deadline as well?
So the group market, you can enroll any month throughout the year, and usually it's the first of the month. So we can get you on for really any time throughout the year. You're not limited to this individual window. That's just if you don't have any employees and you're just purchasing an individual plan.
Okay, I
So
think
I
that's
know
a
we
lot
have a
of
lot more, there was a lot more questions on here, and we are going to do a Q&A at the end. So, and I see a lot of them were also related to that definition of a firm or a group. We will circle back to that, or you can reach out to us at the end of the.
I'm also gonna post a link to, a lot of people are asking for a link to the Texas Bar Private Insurance Exchange site. So I'm gonna place that as well in the chat.
And lastly, an individual, just another clarification, good question I just saw, is individual plan does include your wife or your dependent. So that part is included in the individual plan, correct,
Yeah.
Jason?
Yeah, you can certainly add your spouse or dependents. Just let the benefits counselor know the information and they'll run the proposal for your whole family.
And again, we'll circle back to Q&A at the very end. Let's go through some group options now.
Okay, cool. Yeah, if you want to toss that slide up, I'll just show the group carriers and some of the major group carriers in the market. These are going to be, the carriers that are available in all counties. Obviously, there could be, various counties with specific plans. Sometimes hospitals offer some insurance plans and things like that. But these are going to be the major options out there. The MHP is going to be one you want to consider, Members Health Plan. Of course, Blue Cross, United, Aetna, they've been in the market for a while. Cigna. A lot of people don't know that Allstate offers a pretty good health insurance product as well. There's another new carrier in the market called Curative. It's worth considering because they don't have any out-of-pocket expenses, which I know sounds odd. Usually you're used to having high deductibles or copay or coinsurance. They have a really unique model where they don't have any out-of-pocket expenses. So you can schedule an appointment with one of our group reps to learn more about that. And then Decent is another carrier that has a level funded plan that's in the market as well. So those are all the things, if you're not going through these options, if you're not seeing all of your options, if you just feel, like you're seeing one or two, just know that this is out there. So I promised that I would go through, why do people switch to us, and some options to consider. So, I personally work with firms of 15 or more employees all the way up to a few hundred, been at Member Benefits 9 years. And throughout that time, I've learned that there's three major reasons that people come to us and switch to us for help. So I'll briefly go over those. The first is you're not receiving good service or very minimal service from your current insurance broker. So here's some examples that I hear people say. They have problems with response times, feel like it's hard to get a hold of somebody or too long to get a response back. Maybe they feel rushed at renewal time. Well, I hear a lot of people say that they get their renewal at the last minute and they feel pigeonholed, like they don't have much choice. I hear a lot of them processing or doing their own administration throughout the year, or a lot of people still on paper enrollments. I mentioned that any groups 10 or more, you can get an electronic enrollment system. Some people feel like they're too small for their broker. They're working with a very large broker that works with huge accounts. We work with accounts all the way down to 2. So 2 to a few hundred is our niche. And sometimes people say, I had a good broker, but they got bought out by a bigger insurance agency. All of those are reasons people come to us and change to us. And sometimes people do it without even, needing to change insurance carriers.
Lots of times, Jason, that we visit firms, it seems like whether they're having issues with their current broker or they see something unique about the exchange, they're saying, well, what happens with the broker? And do I have to change it? The partners at my firm like our carriers. We don't want to change anything about it.
Yeah.
How do they go about that?
Yeah, well, a couple things. One is if you're not getting good service, you don't have to wait until your renewal. You can just sign an agent of record letter. We can take over the management of your current benefits and rates. Nothing has to change. We'll implement you on our electronic enrollment system. So that's the first thing is you don't have to wait. And it's really just a simple agent of record letter, and you can begin getting good service right away without having to make any other significant changes. The second reason people come to us is they want to make sure they're seeing all of their options in the market. Because as a consumer, you don't necessarily have access to all the tools and quoting platforms that we have. So you're dependent on your broker telling you that they're giving you the best option. So I have a lot of people that come to me and they haven't seen all their options, or they haven't heard about level funding. They haven't heard about association health plans or other creative options. So sometimes firms every year say, you know, my insurance is always increasing, but the only real solution I'm getting is higher your deductible. And if somebody's with the same carrier for 8 to 10 years, I usually know that they're not seeing their options, because on a typical group, especially with 15, 20 or more employees, you really need to probably be switching carriers every 3 to 5 years to reset the rates. So, you know, that those are a couple reasons as well. So you got the service side of it, which is a big one. You got, I want to make sure that I'm seeing all my options. So for our clients, when you become a client, we have the ability to do a full market analysis for you each and every year so that you don't feel like you need to go elsewhere. You can constantly have a good resource. But lastly, you know, a lot of people want to know, is there an association health plan available? Is there something special, unique for being a State Bar of Texas member? And obviously we've been talking about it. There is the members health plan. So I'll talk a little bit about that. It's an exclusive health plan right now for Texas law firms. It's got the bronze, silver, gold, platinum plan. So we looked at the entire market and we mirrored some of the top plans in the market. So we have some of those top plans. The cool thing is the rates are typically 10 to 20%, or sometimes even more, below the traditional market. We use the Aetna National PPO network, which answers the question if you're in another state. So it's a national network. We offer HSA compatible plans. And then something unique is that we have generic only options that you can save 20 to 25%. So the FDA did a study and says that 91% of prescriptions are dispensed generically. So we can actually put a generic plan alongside with a couple brand plans so that employees that don't take any prescriptions or just take generics can save 20 to 25% on their premium, which is a huge deal. The MHP goes down to 2. So if you do have a group of 2, we will look at you. We do medical underwriting, but then once your rates are underwritten, you are into a larger risk pool. So the idea is that you're going to get better rates and more stable rates. You know, I was just looking at our renewal rates for January coming out, and it's like an average of a 6.3% increase for most groups. And a lot of groups, we rated a little bit higher to be more conservative, and then we lowered the medical risk that we were rating them for. So it's doing really well. If you haven't considered it for your renewal, it's definitely something that you're going to want to consider this year.
Yeah, Jason, I'm always surprised that every time I send an email out, the amount of people that are didn't realize that it existed and are happy that it's there. I want to address a couple of the questions too about the cost, and as well that this is, I want to point out and be clear that this is the association health plan that we intend to open up to solos in January 2025. So this is, and it's called the Members Health Plan, which is the association health plan. So the hope is to have it then. And then also want to point out, because I saw this as a question, is that the exchange doesn't just offer health insurance, it's also all the ancillary products that you would find on the marketplace. And those are the places where you can get some discounted rates because of that group program.
Yeah, so do we have any specific questions that came through about group?
Tom, did you
Yeah.
see?
Yeah, there's a ton of them. And I don't think we're going to get to all of them. So I'll just say right now, I did drop the link in there to set an appointment with a benefits counselor. If we don't get to your questions, please just go ahead and make an appointment. They are in 15-minute increments. That was actually one of the questions, is how long are these appointments? So if we don't get to them here, please just speak with one of our counselors and they'll be happy to help you. But a couple questions back to individual real quick about the subsidies. What are subsidies and how do people get them?
Yeah, so the subsidies are offered by the federal government and you get them through the government. They're basically you got to put in your income. You want to make sure that you put in your income correctly, because if you project it wrongly, then you could have to pay a little bit more later on your taxes. But the federal government is subsidizing health insurance, has been since 2014 through the Affordable Care Act, and they're subsidizing it even through private insurance carriers.
But the income threshold is something that's fairly new, isn't it?
Yeah, it's increased. Yeah, it's increased quite a bit.
Do we have a graphic on that, Corey?
Yeah, we put it up earlier, but yeah, let's show it just one more time. That's a kind of good idea. Yeah, there it is. Again, 200,000, family of five, 12,000 a year. So, a lot of people may think, oh, I make 200,000. There's no way I could get a subsidy. You could. So definitely take that into consideration. And by the way, it doesn't mean you're getting any less health insurance. You're just getting a subsidy, but you can still pick the carrier that works best for you and still get that subsidy.
Couple questions about pre-existing conditions. Can you go
Yeah.
over that in terms of ACA?
Yeah, sure. So all pre-existing conditions went away for ACA compliant plans in 2014. Now, those non-ACA compliant plans I mentioned, there could be some riders in there for pre-existing, but everything else went away pre-2014.
A lot of questions on what the individual plan covers. Is it just the member, or can spouses and dependents also be included?
Yeah, so you can include yourself, your spouse, and dependents, any combination of the three.
And in terms of qualifying life events, would someone transitioning from a full-time role at a firm to a solo position on their own, would that be considered a QLE?
It would be. It's a qualifying life event, and you have a couple options. You can continue COBRA through your previous employer if they offer it, or within 60 days, you can sign up for an individual plan.
Jason, I think one explanation, I might have missed it, but I don't know that we've covered, is the fact that, say someone's in a law firm, whether the partner doesn't want to join the plan or an employee doesn't want it, but the partner does, not everybody in the firm has to participate, right? How does that work?
Yeah, that's correct. So a lot of people will say, I have two employees, I want to be a group plan, but I'm on Medicare or TRICARE. Can my employee still get it? And the answer is yes, as long as you have a valid waiver, we can still set it up as a group plan.
And then speaking of group plans, do you only work with law firms on those?
So we work with a lot of different industries. Law firms is our primary industry that we work with, but we have associations that we work with all throughout the country of different industries. So the answer would be no, we can work with multiple different different industries.
And aside from health insurance, are products like pet insurance, dental insurance, vision insurance, are those available on the exchange?
Yes, that's right. We have a ton of different products that are available.
Someone asked, they had heard that the MHP is available to companies with at least two full-time employees. Has that changed, or is that still accurate?
Still accurate. Yeah, the number two is the number. One, you could be the owner of the firm, the S corp owner, and one W-2, two people total, and you're good to go for a group.
And can you talk about Cobra real quick? Like people who are on Cobra, is it easy to transition to one of these plans?
So if you're on Cobra and you voluntarily drop it and it's not open enrollment, you cannot change to one of these plans. But you can change now for a January 1st or February 1st effective date and voluntarily drop Cobra. Or the other option is your 18 months or your 36 months of Cobra gets up, let's say March, that creates a qualifying life event for you to join one of these plans within 60 days. But it has to be an involuntary loss of coverage. You can't choose to drop Cobra except during open enrollment, which is November 1st through December 15th or January 15th.
Okay. And then back on the group side, we got this question several times. Do employees have to be W-2? Do they have to be full-time? Can they be contract employees?
They have to be W-2.
And what is the waiting period for new hires to join a group plan?
You can set that on each group plan. It's different. Some group plans allow you to create the waiting period first of the month out of date of hire or instantaneously. On our members health plan, I think the lowest we can go is 30 days first of the month, and the highest you can go is 60 days first of the month or 90 days, the 90th day or the 91st day. So there's a lot of different options as far as waiting periods are concerned.
And a lot of questions about canceling coverage. I know, Jason, it's going to vary based on which product, and we've talked about a lot of different products so far. Can you maybe just touch on how someone would go about canceling a policy, a health insurance policy, an individual policy, a group policy?
Yeah, so canceling an individual policy is pretty easy. You can do that directly with the carrier. You can go directly to our benefits counselor to help facilitate that process. And you can do that throughout the year. Typically, it goes to the end of the month. For a group product, most group products you can cancel at any time. So a lot of people actually think that they're locked into their current arrangement until they renew. You can actually, health insurance is month to month for 95% of the carriers you can cancel and move to a different carrier the first of the month if you find a better deal. So let's say, for example, somebody renews their health insurance in June, but they want to start looking at a group plan now because they want to look at the MHP. And let's say we get them better rates with the MHP, you can switch now, and we would just write a termination letter to your current insurance carrier.
I
And
just
then,
I just wanted to put this up just so people know where to get more information about all of this. And again, has the link down here at the bottom about scheduling an appointment. And also those dates for getting individual coverages starts November 1 and ends January 15th.
yeah, and I just pasted a bunch of links in the chat. One is how to schedule an appointment. One is a link to the Texas Bar Private Insurance Exchange. One is if you want to sign up to receive emails about upcoming deadlines and dates, as well as other benefits available through the exchange. And then also a link to the Members Health Plan, the MHP website. I just threw all those in there. Jason, someone asked, will this be competitive? If I have an existing group plan, will your plan be more competitive?
If you're asking if you have an existing group plan like you have Blue Cross and Blue Shield of Texas, will our Blue Cross and Blue Shield be more competitive? Blue Cross and Blue Shield of Texas be more competitive? The answer would be no. We don't have necessarily discounted rates for each carrier. The discounts would come through the MHP, which is our unique plan, and perhaps us showing you some options within your existing carrier that could be beneficial to you.
Okay. And then there was also a question about it. Can you explain, is there a difference, a cost savings when comparing group health versus individual?
Yeah, typically there would be a cost savings on the group side, not always. So we have a lot of benefits counselors that do both individual and group. So you can actually work with them to compare both options.
And just can you clear up a little bit of confusion on the difference between a group plan through the exchange and the difference between that and the MHP?
Yeah, so let's say when we first started working with the bar in 2013, and you would come to us, we would help provide a full market analysis, which would include all the options in the market, Blue Cross, Aetna, United, all those carriers that we put on the screen. And whichever one worked best for you, we could help you with that and we could manage that and service that. We had so many people coming to us saying, can't we just create an insurance plan that pools people together for lower rates? So 7 years ago, we created the members health plan as an association health plan, but we still also quote the other options as well because not everybody is a good fit for the members health plan. And so we still want to make sure that we're providing you every option on the market. So I hope that answers the question.
I think so. I have one for Corey. Corey, you ready for a question?
Sure.
Is this webinar being recorded? And if so, how do I view a replay?
Yes, it's being recorded, and the materials will also be shared. Both will be at texasbar.com/benefits, and it'll be up early next week.
Early next week. Okay. Well, I haven't counted them all up yet, but I want to say there's close to over 100 questions. I hope we got to most of them. Like I said, if we did not, please just feel free to make an appointment with a counselor right now and they'll help you out either way.
Great.
Thanks, Tom.
Yeah. And we'll, like I said, we're gonna do a random drawing following this webinar, and we'll be emailing the winners of the Amazon gift cards.
Yeah. So, yeah, thank you guys for attending and great questions.
And Tom, real quick, I saw someone ask for the phone number. Maybe the phone number is helpful too, if you could put that in the chat.
Yeah, we'll do.
And again, thank you, everyone.
All right. I guess this concludes our webinar. Have a great day, everyone.
You too.